Hi, everyone. Thanks for joining me for a video series that we're conducting with chief nurse officers across the country to learn about how they're handling COVID-19, regardless of whether they're in pre-surge or surge phases. As the first one, we're starting with Jennifer O'Neill right here in New York City with Hospital for Special Surgery. Hospital for Special Surgery is the #1 orthopedic surgery hospital in the US. During this very difficult time, they've been managing overflow of patients from the other hospitals in New York City and focusing on critical orthopedic surgeries, as well as COVID positive patients from April 1st. Jennifer, thanks so much for joining me during this very difficult, I know, extremely busy time for you. We really appreciate you taking the time.
Well, thank you for having me.
Can we just start with you describing your role to me at HSS? I know you've been there for about a year now.
Yep, it was a year in March, so I'm the Senior Vice President in Patient Care Services and Chief Nursing Officer at HSS. I oversee all of the nursing departments, all of our operating rooms, recovery rooms, central sterile, and pharmacy.
Thank you. Jennifer, can you talk me through some of the challenges that you've been facing as you've been going through these conversion of resources and what you anticipate in the next few weeks?
Well, the challenge is to maintain, our priorities are always to maintain safety for our staff, our patients, and serve the community. So approximately, I think about 3 weeks ago, we decided to support the community in taking non-COVID patients to help decant hospitals that were overcrowded. And so we are a surgical hospital, so a specialty hospital. And so we had just-in-time training for our nurses to start to care for a patient population they normally don't serve. About a week ago, we started to take transfers of critical care patients. And so again, we were able to stand up an ICU, converting our ORs to ICUs in 48 hours with an amazing amount of collaboration and teamwork here at HSS. And so again, just-in-time training for the staff to learn how to take care of COVID positive ICU patients. And then it's a week ago today, we were able to get a telemetry, wireless telemetry in within a week. So we opened up a telemetry unit and began taking COVID positive patients from an organization we're affiliated with, which is New York Presbyterian.
Okay, thanks, Jennifer. I mean, that's a lot to be dealing with in a very short period of time. I know that, everyone's emotions are a little heightened now, especially in New York City, and I can't even imagine what it's like for our healthcare workers at the front line. Can you talk to me a little bit about how you're trying to manage well-being, employee burnout, and really just the ambiguity that they're dealing with really their day-to-day roles changing so significantly?
I think it's firstly, it's effective communication with the leadership team, assuring that the team is visible and supportive, that we demonstrate empathy and have a clear focus on what the plan is and that we communicate that plan. That will help reduce some of the anxiety. We've deployed nurse leaders, coordinators, educators, nurse practitioners to assist in coverage 24/7. And that's really adding resources to the front line so they feel supported. We did bring on a crisis management individual who has a background in the military and also a nurse, and he is available and rounds on the floors, and we can deploy him where we feel that areas may have a heightened level of anxiety for the shift. We also have resources, social workers and psychiatrists. We recently created, we have something called Perfect Serve, which is where we can text each other. It's secure texting. And so we created giving the staff the ability to text crisis management or wellness. And there's an algorithm that's developed so that it'll get them to the right resources that they need. Obviously, we feed the staff. We are deploying some hand lotion. We have some donations of self-care kits. And most recently, we'll be giving out ice packs that in high stress situations that will help reduce stress, refocus on huddling and deep breathing to make sure that we maintain as little stress as possible in a very anxiety inducing environment. And I think just continually over communicating. We have live streams with the staff that's ongoing so that they understand the current state, what's going on in New York, and also what we're doing to help serve the community.
That's really great to hear, Jennifer. Thank you. Had we known how bad it was going to get in New York City, maybe say even a few weeks earlier than anticipated, what do you think your leaders, you and your leaders at HSS may have done a little differently?
If we had known, probably an orientation to managing COVID positive patients, I think that would probably be what the staff has most concerns about. How do you document? How do you care for these patients? It's a completely different patient population than we serve. We serve healthy orthopedic patients, so surgical patients. Mm-hmm. So this is a challenge for them. So I think training would probably have been something we would have liked to have started earlier.
Jennifer, finally, what are the positive lessons learned that you think you can share with other health systems across the country and even globally as they prepare for their peak and surge times as well?
Well, I think it's maintaining a sense of calmness as a leader, making sure that we remain focused, making sure we take care of ourselves, and a lot of positive energy. There's been a lot of photos and we clap out our patients that we're discharging. We certainly have videos that we share. We've been in contact with NYPD, the fire department. They've done clap outs at 7 o'clock for us. Just trying to keep the energy level positive because there's a lot of rough days that we've experienced and are certainly ahead of us. So I think maintaining that communication and trying to find the wins amongst each other so that we can share, so that people know that there's a light at the end of the tunnel.
Thanks so much, Jennifer. I really appreciate you taking the time, and take care of yourself and your staff and stay safe right now.
Thank you. You as well.